Hello, and thank you for joining us for Civic Summit Obesity, Weight Loss, and Body Acceptance. I'm Seema Mather for KLRU. 1 out of 3 people in America struggle with obesity. The challenges they face are more than just physical. Advocates for the rights of obese people say the stigma is a form of discrimination that is still condoned by most. Tonight, we will focus on what it means to be obese, what it is like to live as an obese American, and the options available. Joining me for our discussion are experts in the field of mental health, bariatric surgery, as well as the rights of overweight people. First, Dr. Connie Stapleton, a psychologist and author of 2 books on the subject. Joe Neglowski is president and CEO of Obesity Action Coalition. Abby Lentz is the founder of Heavyweight Yoga. And John Archibek is a bariatric surgery coordinator at St. David's Medical Center. And thanks to all of you for joining us today.
Thank you. Thanks for having us.
And Dr. Stapleton, I'll start with you.
Okay.
In your practice, what do you see as some of the stigmas that obese people face?
Obviously, there are a lot of social stigmas, but I think that the stigma that I am most aware of with my patients is the way they stigmatize themselves through their negative self-talk. And it's such a huge problem that I tell them, if I could give you one gift, it would be to learn to talk more kindly to yourself. And these are internalized messages that people have gotten from society and people that they've been close to. So I think that's the stigma that I would like people to overcome.
And then Abby, you're in a very interesting position of working with heavyweight people and in your classes. And how do you feel that people internalize those stigmas, and how can we overcome that?
Well, I think it's the randomness of it. You can be hurt, be discriminated against by somebody you've known all your life and love, or a stranger in the supermarket who doesn't even know your name can still make you feel really bad about yourself if you allow them to do that.
And how do you find that by doing yoga that people are able to overcome that and have more body awareness?
Well, yoga's been proven over thousands of years to be beneficial, and most people think it's all about the asanas, all about the poses. But it's really the sense of well-being and the mindfulness that you give yourself. And as Connie was talking about, it's that internal dialogue that you have. In a balance pose, I always end balance poses with asking you to talk to yourself as if you are your best friend. Mm-hmm. Yeah.
And Joe, I mean, you deal with this a lot. It's so much about the work that you do, and some people have said that the discrimination against people who are obese is very much similar to some of the issues that we fought in the civil rights movement with, fighting for your rights in the workplace and public spaces. Can you tell me about that?
Yeah, so if we look at weight stigma, bias, and discrimination, it affects, the majority of people it affects are women, actually. Women who struggle with their weight seem to be the primary group that struggle. And it really does impact their lives. And it is so ingrained in our society. People believe that it's okay to make fun of people who struggle with their weight, not treating it as a medical condition, as I believe it should be treated. And it is so ingrained that people forget about it. It's insidious. It is in every part of our culture, in our media, in our public offices, wherever you go, in your doctor's office, in our healthcare system. Insidious in every single way. It really brings, it really makes it difficult to take this issue on yourself and live with yourself, as Abby and Connie said. It just hits you by surprise in so many different ways. And I think as a society, we have to stop shaming and blaming people. If we really want to address the obesity epidemic, it's time to end the shame and the blame.
Mm-hmm. And then we were talking earlier about the discrimination that happens in the workplace and the protection that's barely available.
Yeah, so most people would think that if you struggle with your weight and your employer fired you based on your weight, that you would be able to take legal action against them. But the reality is there's only one state right now, that's the state of Michigan, that has a law that offers that kind of protection. Every other state, your employer could fire you because of your weight. There are some exceptions. If you struggle with severe obesity and you could be classified as being disabled, you might be covered under the Americans with Disabilities Act, but the case law is actually mixed on that. And so this is really surprising that these kind of protections haven't been put in place, considering how high the number of people are that are affected by obesity.
And John, I mean, you struggled with your weight for many years. What were some of the stigmas that you faced?
There were quite a few. I think people treat people of obesity much different than they do treat people of normal size, or what we consider to be normal size in the United States. I think these stigmas are based on a lot of biases that are the social norm, and unfortunately they're acceptable. And what we have to do is grow as a society to improve on this. And I think a lot of times in healthcare, we're improving a lot in the United States, but we still got a long ways to go. And what my goal is to help people seek health care, because I think a lot of obese people won't get the health care they need, and they unnecessarily get sick because they feel that they're going to go to the doctor and the only answer they're going to get for their treatment is that you need to lose weight, when they really do have another true medical situation that needs to be treated.
Kind of, you're nodding your head a lot on that.
Absolutely. I think that so many of the patients that I work with have been so shamed in the healthcare system, and research shows that the healthcare professionals, not just the physicians, but the nurses and, you know, a lot of the staff have negative feelings toward the obese patient, and everyone's worthy of the best care possible.
And getting that care, getting that access to care is an issue.
It is an issue. So, for example, most people don't have the ability to walk into their doctor's office and have a conversation with their doctor about their weight, and that visit be covered by their insurance company. And this baffles me, as we know that obesity is linked to so many other conditions. And then, many times, if someone does walk into their doctor's office and they do struggle, the opposite happens. They may be in with the flu, and then the doctor blames the flu on their weight, which is the wrong message as well. So we have these two paths that are very different, and it makes it tough for you to walk in and have that conversation with your doctor, which is a very, very important one. You know, one thing I'm going to challenge this group up here to is that we have the tendency to say the word obese person or obese patient. And actually, that's not the right language. It is an individual with obesity or a person with obesity. If obesity is the medical condition that all of us believe it is, the American Medical Association, the American Psychological Association require people-first language. You don't say, I'm a diabetic, you say, I'm a person with diabetes, or I have mental illness, and I'm a person with mental illness. And so I would challenge us to say person with obesity instead of obese person. It's just a subtle way I think we can start changing and tackling this bias issue.
Well, language does get to be so important, because we want to mask this medical problem with all kinds of different plus size, curvy, you know, there's all these different ways for us to try to say, I'm an obese person. Yeah? And we keep that awareness away from the person, so they really don't address the fact that they have a medical condition that has many solutions.
Speaking of those solutions, you chose to undergo bariatric surgery. Why did you decide that that was right for you?
Well, back in January of 2009, I had a gastric bypass. And it was a very interesting aha moment that I had with my physician. I was seeing a gastroenterologist because I had a history in my family of polyps. And so I went and saw my doctor, and we were getting ready to schedule a procedure. And she told me, she says, let's not plan for your next procedure, because in most cases you'll probably have died before the age of 50. And it was so scary, but it gave me that wake-up moment that says, you know, John, you're an obese person, and you need to get this under control. I didn't really like her tactics, but it did bring attention to the issue that was at hand, and I needed to really and I thank her every day that I see her, that she got me focused, and that to use this option of bariatric surgery to thin and to diet appropriately, and to learn how to exercise and drink my proteins, and drink my fluids and get my sleep, which I didn't really have a real protocol for myself to even follow. I was just trying to stay alive, but realized that I was really dying in the process.
Mm-hmm. You're such a unique position, really, because you schedule these surgeries for patients, and you were a patient, that I think that you can be such an insightful advocate as far as for people that are considering this. Like, what questions do they need to ask? What do they need to know?
I encourage people to bring any question they have to the table, because any question that they have is an important question for me to answer for them. And it seems that every time I meet with somebody, I get a new question out of it. What I encourage people to ask is, what is normalcy before surgery, and understand what normalcy is going to be after surgery. And people want to be the same. They say, well, will I be able to eat a cheeseburger after my bariatric surgery? What I encourage them is that if we continue the normalcy that we are before surgery, we're going to get back to the same situation that we were in. And so that makes us, again, sometimes even more obese, because bariatric surgery is just a tool. We have to learn the behaviors that go along with it. We need to make those dietary changes. We need to eat more healthy. So there's an entire process that goes along with the tool that we're given.
Do you think that you would have gotten to your weight without the surgery, or do you think that was necessary for you?
My answer to that personally is no, but statistically it's also no. So people that have a BMI of greater than 40, 95% of the time, they'll never get lower with just diet and exercise. So bariatric surgery happens to be that edge that we need. I was a perfect candidate for the procedure because my BMI was in the super obese category. And it's very interesting, in the United States, 20 years ago, we just had obese people. Now we have people of different obese sizes. And so now we have this super obese category, which is very popular on TV. Mm-hmm. And it's very sad, because we try to not discriminate against our patients, and we try to make sure that we have the appropriate equipment in our hospitals. That's why there's a lot of dignity that goes along with this process. But in a lot of these shows, they're showing these people being weighed on freight scales. And mm-hmm. It's just an unfortunate thing, because that is a norm in our society to get the attention of every everyday person. And we need to treat our obese patients with the dignity they deserve.
Those shows tend to play into that circus-like atmosphere where you feel like you are the event, you are the fat lady in the circus, and that everybody wants to see what's happening to you next. And it's really easy to forget that these are real people with real problems and real lives. It's not just their weight that they have to think about, right, but it's putting a roof over their head and feeding their children and all the other things that everyone has to deal with.
I think it's important, too, to recognize a lot of those shows set unrealistic expectations for what success is. Mm-hmm. And I would just like to remind everyone that we come in all shapes and sizes. Before we had an obesity epidemic, we still came in all shapes and sizes. Not everyone will reach a BMI of 25 or less. It's a goal, an epidemiological goal, when we look at studying thousands of people, not individuals. And I think what's important for people is that they get as healthy as they can be. And that doesn't necessarily mean that they're going to have a BMI that's going to qualify them to be on the cover of Men's Health or Women's Health magazine. Mm-hmm. That can be someone who society may say is still heavy, but they're healthy. And I think that's the key. If we set a body image expectation, it's almost impossible to meet, no matter what intervention or what therapy, surgery, medications, behavioral counseling. You're not going to meet that if it's all about body image. It's got to be about health, and that is a goal that people can make and reach.
It's interesting because I do evaluations prior to surgery, and people say their goals for having weight loss surgery are improved health and a better quality of life. And yet, what I find so often is that 1-2 years down the road, there's an obsession with size of clothing, size of, this number on the scale, it becomes an obsession. And so it's about reminding people about what is healthy for your body. You know, have you accomplished your goals of improved health and having a better quality of life? And yet there's so much emphasis on the numbers, on the numbers, on the numbers. And so I think it's more important to get back to the importance of living fully and enjoying a quality of life at a healthy weight.
And are there certain characteristics or even a mindset that people can get into to prepare themselves for weight loss so that they can be successful?
I think there is, definitely. And I think, unfortunately, there's less of an emphasis on that than there needs to be. Weight loss surgery in particular, it's such a medically based field that most of the emphasis is on the surgery itself, and it's kind of like a wedding. You know, you have the surgery, it's one day of your life, and every day after that is learning to live life with these healthy behaviors. You get married, one day is a wedding, and every day after that is marriage, and they're not the same.
Right. Not always the honeymoon.
And it's not always the honeymoon. And so I think there needs to be more preparation, and I think the system's a little bit flawed in that regard because there's such a rush to get the surgery, get the surgery, get the surgery, instead of preparing to actually have the skills in place to know how to effectively cope with life and not use food as...
I think one of the ways you can think about that is if you treat obesity just like you would any other chronic disease. And the reality is there isn't a cure. And so therefore it is something that you're going to deal with the rest of your life. So if you've struggled, the reality is you're likely to struggle for the rest of your life, no matter whether you've had surgery or you seek another intervention to address your weight. And I think if we look at it with that chronic disease model and set the expectation that this is not something that's one and done, and even if you do lose the weight, the reality is you're probably going to struggle with those issues the rest of your life. Again, it's setting a realistic goal for people and a realistic expectation of what weight loss can be achieved and what procedure might be right for them.
And the depression rates for the obese population for people who suffer from obesity is much higher than the population at large. There's numbers from 29 to 56% versus 17% for the general population. And so we're asking a group of people who suffer from depression, anxiety, low self-esteem, low self-efficacy to do the things required to sustain positive behaviors when they don't believe that they've been able to based on their past trials. So there needs to be a lot more support.
A lot more preparation before you even go into it. Okay.
I think Joe points out a very important thing, and I want to bring that up from more of a personal standpoint. I still struggle every single day with my weight. I still do classify myself as an obese person, and I want to remember that I was an obese person. I don't want to forget that part of my life because that's who I am. But I have to realize that I have to follow the rules every single day, or I can fall into the same old gap that made me obese in the past. And I was an obese kid. From second grade on, I had been obese. I was obese in junior high. I was even bigger in high school. I lost a little weight when I was in the military. That's why I could get in and stay in. But what ended my Army career was that I ended up getting heavy again. And I couldn't get it under control, so it was easy for me to get out, then correct my behavior. And then I went into the real world and then realized I got bigger and bigger, and then I had to figure out a plan for myself. And everybody has to select it, and it's a personal selection. It's a personal selection for the procedure, and it's a personal goal that some people need to make if they are obese.
Okay, thank you so much. So as we mentioned, some people choose to undergo surgery to help start their weight loss journey. And while various procedures do help people achieve a healthy weight and look, the path to getting there involves a lot of hard work as well as dedication to healthy eating and exercise. And even with this effort, many require additional surgeries. One procedure that's common is removal of excess skin after the pounds are shed. Here's one woman's story.
Let's go. My name is Jackie Hatfield. I am 24 years old. Come on. I grew up in a small town called Farmville, Virginia. As long as I can remember, I was always obese. My highest known weight was 365 pounds. I just wanted to get to a healthy weight to where I could actually be a lot more mobile. I've been on this journey for at least 4 years now. I had gastric bypass when I was 20 years old. I lost the majority of my weight during that first year. I've lost a total of about 150 pounds. You can still gain weight. If you're not doing the right things, everything can come back.
Five more. A little faster. 4, 3. Really make sure you bend at the elbows. 3. Come on, 2 more. You got it, Jackie. Last one, all the way up. And stop. All right, jumping jacks. You ready?
With the excess skin, it's hard to work out. With losing 100 plus pounds, it's just that it's been stretched so far, it's not going to go back.
You got it. Ready? Go. Go, go, go. Keep moving, keep moving.
I didn't realize how much problems the excess skin was going to give me.
Keep going. Come on, Jackie. Push. Open up your feet like you want it. You ready? We're almost there. Don't give up. 15 seconds. Push, push, push.
I hate you right now.
You need some water?
It's embarrassing. People will stare. I have to wear special compression garments. Not only that, it creates a smell after a while no matter how much I wash. I get horrible rashes. It's not going to come off because it's skin. To be honest, I still feel like I'm that 365-pound girl. I figured that there had to be something that I could do. I wouldn't have known that this was an option in my life if I didn't go out and do the research. It really depends on your insurance. Luckily for me, my insurance is covering all of my procedures.
So the first couple of lines I draw are vertical lines. This makes sure that I line up the north and the south.
I'm having 3 different procedures. The first step is a 360 body lift, the abdomen, the lateral thighs, and the buttock. The second surgery, I'm having the medial thigh lift, the inside part of the legs, a torsoplasty, my arms, and then also my breast. Since I'm having 3 surgeries kind of back to back, it might be a little while for me to heal. I know I might be a bit of an emotional wreck. I know I'm going to be in pain, but I'm ready. After all 3 of my surgeries are done, it will be at least 50 pounds of skin.
You're doing great, Jackie.
The one thing that I'm super excited about, he makes the cutest belly buttons. I can't wait to have my new belly button. I really want to be able to go shopping. Like, I want to be able to not wear these baggy clothes. I just want to get a simple dress, like the summer spring dresses. I finally get to finish up my dream and my weight loss journey.
Watch your back. Think how nice you're gonna look when you wake up.
I know. I would be a sexy mama.
I think a lot of the public, and especially general surgeons, are being a lot more honest with patients and telling them, you know, you're going to need reconstructive plastic surgery after your weight loss. And I think that's really good for patients to know that, you know, after the weight loss, there is hope. So here's our belly button popping through. Good.
Jackie? Hi, we're all done. Let's see, this is already opening your eyes.
Even though all the excess skin is removed, the thing is, it's a journey that never ends. You have to maintain and do everything correctly and follow the rules by the book.
Let's turn back to our panelists. We just saw that the journey is long with bariatric surgery, and it's not a panacea. And there are so many issues to talk about after seeing that, and so many great points raised. But I'd like to go first to just even the insurance coverage of this. I mean, we talked a little bit about that earlier, but how difficult is it for one, the bariatric surgery, and then the follow-up type of surgeries to be covered?
So bariatric surgery is now more commonly being covered by insurance. In fact, most government plans, including Medicare and Medicaid, as well as state employee plans and others, cover it. So it's becoming much more common. However, if you work for a very small employer or you're buying an individual health plan, it's very, very difficult to gain coverage in those cases. Plastics afterwards, these procedures afterwards, are rarely covered. In fact, I know in the example we saw, they were covered. That is usually very rare, or if they do cover, it's only the small amount to address the pannus issue, which may fold over and may get some infections there and things like that, but it's usually a very small part of the procedure. So that is a bit of a rarity, and it is a real challenge for folks trying to, these procedures, especially the plastics afterwards, are very, very expensive, and so it's important that patients plan for that as they move forward and understand that there may be a cost to them down the road. Curiously, we've seen a couple employers offer incentives to their patients where they are paying for their bariatric surgery if they stay going to support group every month and doing their follow-up visits. After a couple of years, they'll actually pay towards their plastic surgery as an incentive to keep them in the program and moving forward successfully. Now, we haven't seen the results or the studies of that published yet to see if it's an effective tool, but my guess is it may be one that helps people in the long run. And is any of this going to change with the Affordable Care Act? So the Affordable Care Act is a bit of a mixed bag when it comes to bariatric surgery. About half the states in the country will see bariatric surgery considered essential, meaning it'll be included in the health plan they can buy in the healthcare exchange. The other half will not. So it is literally almost a 50-50 mix. And so I think time will tell. And our hope, of course, is that in states that are covering obesity services like bariatric surgery, because there are other obesity treatments as well, that hopefully we'll see lower healthcare costs out of those states, and that'll motivate the others to adopt those procedures as essential as well. And it's so important, especially the follow-up surgery. You go through so much and you lose the weight, and that's so difficult. And then to be left with excess skin, how does that affect some of the patients that you work with?
Well, it's tremendously impactful. You heard Jackie say she still felt like, I mean, she had lost 160 pounds and she still felt like she weighed as much as she had before. And then the body image issues, to look at that, to be reminded of that shame and that pain and that sadness and that discouragement. Because some people have said, I liked my body before I lost the weight better than I like my body now, when they have all that extra skin. So the issues fluctuate a little bit. And so the focus, from my perspective, is on gratitude for what they were able to do that they weren't able to do before, the health improvements that they're able to enjoy that they didn't enjoy when they were at their highest weight. But it's a very difficult issue.
I definitely identify with Jackie. After losing 167 pounds, I also had a 360 circumferential abdominoplasty. It was a personal choice, and I did have to pay out of pocket for it. And it was unfortunately my insurance. I wished my insurance would have paid for it. But I really think that I needed it from my own psyche standpoint. Because I felt a lot like her. I still felt like a very obese person because I had that excess skin. And having that excess skin lay almost on your knees, you know, really, it's kind of, it brings you down. It's very depressing. And my goal was, I always just wanted to fit in a nice pair of jeans. And I felt that I couldn't because I had to stuff this apron inside my pants. And so I wanted it from my own standpoint. I also couldn't sleep with it. You know, every time I rolled over, I pinched it, it would wake me up. And And so that was really my medical excuse to have it. But really, it was a personal one. I think that I probably wouldn't be here today if I didn't have that, because I needed it for my self-esteem.
What I find on the yoga mat, where people, their bodies are so exposed and they're coming into contact with it, often when people have had the reconstruction, they still move. There's this lapse of a time where they still move as if they were reaching over everything. It's still present, it's still there. It takes time even to adjust to the slimness of you. And of course, if you haven't done all of the work, you're uncomfortable with that new skin.
So much going on psychologically as well. What did you experience?
My stomach looked a lot like hers at the end, and then over time, some of my skin, because of age, still had some stretch to it. So I ended up having to make a evaluation in myself to say, that I love me, that I'm happy with me, and that my answer wasn't another plastic surgery. If I could afford it, I probably would, but I ended up having to decide again and make that decision that, to be happy with what I've been given. I got what I wanted initially, but I needed to figure out, will I be happy? Because I exercise a lot now. My goal is to do a full marathon. I do almost a half a marathon every weekend, and that's just part of my journey. But when I move, I still feel things moving, and that skin's just, going where I don't want it to go. And I realize I'm not going to be 20 years old and have that 20-year-old physique. I have to now embrace my current physique, and it takes a lot of effort to do that. But I'd rather be where I am today than where I was yesterday.
And that's why part of the preparation, whether it's weight loss, regardless of the method, and plastic surgery or reconstructive surgery, expectations are so important to talk about, because if you go into something like that thinking you're going to have a 20-year-old body for the next 30 years, we got to talk about those expectations, because you're going to be sorely disappointed.
Yes. Another thing is, I think we come into bariatric surgery with some unrealistic expectations, and when they don't work out, it brings us lower than where we started. It's just so important to set some realistic expectations. One thing that I had to learn as a bariatric nurse and as a bariatric patient, that my success didn't come from weight loss. My success came from seeing that I was a healthier person. I was one of the lucky ones, and lucky from my perspective, that I started my journey off about 305 pounds. On the date of surgery, I weighed 292 pounds. My lowest weight was 136 pounds. So I got down to that book standard. But that book standard is for somebody that was at the age of 21. It was not a realistic expectation for the rest of my life. And when I started regaining some of that weight, it was scary. But I had to realize that, and it's kind of weird, because I tell people, I give them a little factor for their age, and I wasn't giving myself that factor. And so when I went back and I added that in, and I said, I'm really where I'm supposed to be, and I need to not just look at the scale. And I rarely get on the scale these days, because I'm always looking about, can I still run on the weekends? Can I still go out and be coached to be a better person every single day? If it's from, meeting my friends who are also psychologists, and they're telling me, you're doing what you're supposed to be doing, John. Be strong with yourself, love yourself, stay independent, and don't let your past guide your future, but learn the things that you need to learn now. That's why it guides your future in a positive direction. And it's an everyday journey. This journey never stops.
I don't know if it was like this for you, John, but I know in the 10 years I've been doing this, regardless of what you tell patients ahead of time, they think they're going to be the one to have the perfect recovery journey. Like people getting married think they're going to never have a fight, right? So, regardless of the preparation, there needs to be follow-up, because there's fallout. emotionally.
Right. I think one of the things that we forget is, and when I bring patients in for preoperative education, my focus is not the surgery. The first thing I set them down and I said, our focus today is aftercare. So you've already talked to your doctor, your dietitian about the surgery, but it's all about the aftercare in the end. That means coming to support groups, engaging in the support groups, and understanding that the most important time to come to the support group is when you don't think you need anybody in the support group. You know, participation is the best thing for recovery. And if you don't grasp that this is a lifelong disease, then you're gonna end up failing at some point. Failing doesn't mean that you pick up the hamburger and eat it. Failing means that you continue eating hamburger after hamburger after hamburger. What you need to do is you need to embrace the journey. And that's one of the things that we talk about. Our support group has another support group within itself, because our folks wanted to keep in touch with each other every day. And so they did put a Facebook page together, and they talk to each other every day, because we hit our milestones every day, and we want people to celebrate those milestones, but also to understand when they're not hitting a milestone every day, it's not bad. But it's always good to make sure that, you know, the next milestone may be in 6 months, it may be in a year, but that we're going to meet those milestones.
I think it's so important in your work, Joe, that big companies, small companies, all companies provide incentives. I think that reconstructive surgery would be a tremendous incentive for patients.
You know, we're hopeful that employers, especially insurance companies, are starting to see the light and recognize that addressing obesity is something that's both good for the employee but also good for the employer as well in the long run. And I guess, you know, we see some abuses of that system where employers are intentionally discriminating against or penalizing their employees who struggle with their weight, but we see others that are really looking at comprehensive ways where it's something they're doing together. It's the employer and the employee working together, so the benefits are being provided and the environment at work is being created to be healthy, and there's room for physical activity and all those things. And so I'm hopeful that we're getting close on that front, that we're seeing this kind of holistic approach, and that there'll be options for people and they'll be able to get the help that they need, whether it's, you know, behavioral, medical, surgical, no matter what method they choose to address their obesity, that the option is there for them.
And bringing people.
It's amazing how many people think that the surgery is the easy way. And there's so much work. There's work before it, there's the healing, there's the work after. It's a lifelong commitment to altering your physical self surgically. And I find that yoga is a great tool for helping you really come to your own mind, because it's so easy to get swept up in the hype. It's easy to get swept up into your friend's success. And then you end up really getting on the train, and it really has stopped being about you. You just think, this is what I need to do to get rid of this weight and to be normal. And we all want to feel normal. But at the end of the journey, you find that normal is so personal to you, that that body, that new body you have, unless you've done a lot of work around it, is not comfortable.
From a psychological perspective, I think that the yoga is both physiological and psychological healing. I think it's wonderful.
Well, I teach awareness, acceptance, and affection. And that's my basis of yoga. It's not, can you stand on your head, which would be dangerous if you were obese or even moderately overweight. But I want you to become aware of your body, accept your body the way it is that day, whatever shape or size that is, and then come to love yourself.
Great point. That's going to take us to the next piece. Good. So not everyone who classifies as obese feels that they need to lose weight. There are many people who are happy at any size. And here's a story of one woman who is quick to tell people that her happiness is not size dependent.
What was our new logo? Class, sass, and a lot of ass. That's our new logo.
Come on, ladies, let's pick it up. I want to make sure we can get through everything in this rehearsal. My name is Reagan Chastain. I am the director and choreographer of More Cabaret. I'm from Los Angeles, and I write the blog Dances with Fat. I speak and write about self-esteem and body image and health at every size. I had danced all my life growing up. When I lived in upstate New York, I was a competitive figure skater. And when I lived in Montana, I did more musical theater. And like I did, you know, sort of whatever had a stage and a spotlight in whatever little town I was living in. So it's going to be, don't hand me no lines, your hands to yourself. I walked into my first competition thinking that it would be all about my dancing. Go like this, put your left hand on the hip of the person next to you. I got really good crowd response, but I had several judges tell me they wouldn't give me higher scores unless I lost weight. Yes. And this judge said, I mean, in that dress with your arms out, I couldn't stand to look at you. And I said, okay. And then she put her finger in my face and like with bulging face was like, you have no business wearing spaghetti straps. And like it clicked for me, like, yeah, the way I'm treated as a fat person is really, really not okay. In that moment, I realized if I want to be a fat dancer, I'm going to have to be a fat activist to get it done. Now, let's try this. More Cabaret is a dream of mine. To have a professional dance company made up of fat women. We tend to hide fat people who are successful at anything. And so fat people don't have role models. We see ourselves in stories about insurance and healthcare costs. My goal was to rise above that and put us on stage in a way that people could not deny. So I'm really happy with that. Okay. I think that's how it's going to go fine. There you are.
Well, have a seat. I'm missing.
The show is a way for people to see that a dancer's body belongs to anyone who wants to dance. I spent so much time hating my body for not looking the way I thought it was supposed to look. I had an eating disorder. I was a compulsive exerciser. There's this idea that there are healthy habits for thin people, but then fat people have to do these other things. Drink a thin chocolate laxative-laced beverage 3 times a day, and then like that's healthy for you. Beautiful. This prevalent idea of like weight and health are the same thing. I mean, there are healthy and unhealthy people of every shape and size. That's plainly observable. And so I was being treated for an eating disorder and simultaneously told by my doctors that I needed to lose weight to be healthy. But I was doing this incredibly strict diet and I was gaining a pound a week. And so I was like, this is ridiculous. So I went in and I said, yeah, I quit. And they said, oh, you can't quit. And I was like, I'm pretty sure I can. And they were like, no. So they put me in a little room with a big poster about not quitting, like literally the kitten hanging on a rope. And a woman came in with this binder of pictures. She started flipping through it, and it's just pictures of fat women just kind of hanging out being fat. And she said, maybe you don't know it, but this is what you look like. And these women are going to die alone eating bonbons. And is that what you want for your life? And aren't you tired of hating your body? And some really cool things happened, right? First of all, I was like, that's what I look like? I thought I looked so much worse than these women. So I was like, holy cow, like that's fantastic. I had no problem with these women. I didn't know what bonbons were, so that sort of went right over my head. But I was like, God, I am tired of hating my body. Like, I am exhausted.
With class, sass, and a whole lot of ass. More Cabaret.
The main rule of More Cabaret is that there's absolutely no negative body talk. Your body weight may change. You might get lighter, you might get heavier, right? And like my heart beats and my eyes blink and I breathe and all those things happen without me even asking. All bodies are amazing. There is no size requirement for being treated with basic human respect.
Well, that type of self-acceptance is fantastic. I wish that we all had that all the time. One thing that Reagan said that I really liked, Joe, that probably resonates with some of the work that you do, she said, there's no size requirement to be treated with basic human respect.
Yeah, I believe very strongly that we come in all shapes and sizes. No one should be stigmatized, discriminated against, made fun of because of their weight. The simple reality is people do it because they think somehow they're helping people, they're motivating them to be able to address their weight. And I will tell you right now that Every bit of data we've seen shows the opposite is true. It actually sets people back. It doesn't help them. So if someone who's watching this is actually engaging in that behavior, I'd encourage them to change. And if you have your body, you can be healthier wherever you are. It doesn't have to be dramatic weight loss. Again, we're not all meant to be a BMI of 25. We can be healthier no matter where we are on that journey. Usually, and I'm going to be honest, there are people who struggle with their weight who do not have health problems. So it really is important that if you feel as if you're struggling with your weight, before you engage in any kind of program to try to lose weight, you have a conversation with your physician or your healthcare professional around whether or not your weight is impacting your health. Just like there are people who can drink and smoke every day of their life and live to be 105, there are people who carry extra weight. It is not immediately a health problem. That's for your doctor and you to decide together, not something you should be thinking about just on your own. You really do need to seek professional advice in that situation.
At any size, Reagan's going to be a force of nature. I think we're all in
Yeah.
agreement with that.
Absolutely.
She is so dynamic, and Austin was so lucky to have her here. And if you ever attended any of her dance classes, you understood that she made you feel like a rockette. And it didn't matter how high your leg was kicking or not kicking, how in step you were. She made you feel really good about your body and good about yourself. And that's part, I think, of that health at every size movement. But that doesn't give you permission to be ignorant about your health.
Right.
You still have to address your health issues and be sure you have the correct data for yourself. That your numbers are not out of alignment, that you truly are healthy, that your sugars are good, a good level, and your cholesterol. And even then, with physical activity, that doesn't address the fact of joints. And having fallen off my bike and broken my hip and have an artificial hip and an artificial shoulder, joint replacement is not my favorite topic, and I do pretty much anything to save my knees to not have that happen to me.
It is interesting, too, on how we define beauty. And,
Yes.
and when Reagan is such a good example of also projecting and having the positive self-talk. And not only does she feel happy about how she looks, but you look at her and you say, yeah, she's beautiful, she's perfect. So we can change attitudes, too, by how we project ourselves.
I have to play devil's advocate just a little bit. And if Reagan, if that's who she is, I've never met her, so I can't say anybody who feels confident about their body, if their health is in check, more power to them. But I also want to say that I've met and worked with a lot of people who sang that song prior to losing weight, and then after if at some point they lost weight, they said that's what I had to tell myself. And it's not just a person who has obesity that does that. A lot of us do that in a lot of arenas. It's a coping mechanism. And so I genuinely hope, and it sounds like she truly is, okay with her size. And if her health, there was nothing mentioned about her health. So if her health is good and she's doing what she wants to do, I think that's wonderful. But I often think that that's a way to get by.
From a health perspective, statistically, as your BMI increases, the less healthy you are. And when you start lowering your BMI, you're going to be healthier. And in some ways, I do feel that we make an excuse to cope when we're very heavy. But we also need to look at it, from a long-term standpoint. You can be 20 years old and be obese and be without a comorbidity or without an illness related to obesity. But if you stay obese, the longer you are obese, the more problems that you're going to have medically, such as type 2 diabetes, hypertension, obstructive sleep apnea. We know that statistically that will happen over time. So our goal with losing the weight is to keep you healthier longer, to improve your quality of life. And that's Reagan. she's great. And I like how she projects that, because I think sometimes we come to the table as bariatric patients and we say, we're going to have bariatric surgery and the world will become perfect. And then we have this realism that, oh my God, it is not perfect. We still have to live every single day. We still have to go to work. We still have to struggle paying the bills. We still have to do those things that kind of led us sometimes into unhealthy eating. And so we really always need to look at this from a big dynamic perspective and not just narrowing our focus. And that's another thing I like to tell my patients is that it is scary to lose the weight, because I think a lot of us feel that as we narrow our anatomy, that we're narrowing our perspective on life, and that's totally not true. What we do is we learn more about ourselves, so our perspective, our personality, all those things about life end up growing around us, and we have a bigger perspective, and we're out there being more, bringing more people into our group. One of the things, if I was obese today, I would not be here today. As I lost my weight, that's one of the reasons why I'm here. That's one of the reasons why I got comfortable teaching. And that's why I like to bring patients that are considering obesity surgery or looking for a healthy means I can sit down with them and say, you know, there's options for you.
You know, Joe, when you said at the beginning that we need to speak about this population as persons who suffer from obesity, I think that was brilliant. And my bias is that there's not enough focus on the person long term. Especially in the surgery community, we bring these people in and we alter their anatomy drastically, and then they're kind of floundering unless they have a really good support afterwards. And these are people with feelings, and I think that we're letting them down as a medical community, particularly in not having, you know, more services available in the programs, and not bringing in people who do the exercise into the programs, and not having a focus on the tremendous emotional changes people go through
John,
afterwards.
what did you feel that you needed the most when you were making these adjustments to life as a different person, and even the support that maybe you needed as far as foods that were available to you?
When I started off my journey, I primarily had surgery at a hospital, and they let me go home. Being a nurse did not help me at all. I struggled. You know, I tried to do my studies on the internet. You know, I was always hoping for the best. When you pick a place to have surgery, you got to make sure that is a well-rounded program and not just the destination to have surgery. If you have to have the support group, you have to have the nurses in the hospital that understand people of size, that your hospital has size-appropriate equipment for you. That's why they can take care of you safely. And while I think that the hospital that I went to had a lot of that, there was no bariatric coordinator that came to visit me in the hospital and try to help me guide that path, get me at least started. How I got started was a friend of mine had bariatric surgery, and she kind of helped me and held my hand. But what I really needed was that community. And that's one of the things that we built in my program, was we built that community. That's why people never feel alone on the journey, that there's always somebody there. You know, if it's 7 o'clock in the morning or it's 2 o'clock in the morning, either myself or another nurse in my group, or somebody, a lay person in the group, because that's all about support. You don't have to be a professional. You just have to be in the group.
I think Reagan touches on a really important part, which is the self-hatred. And you may be able to say, oh, I hate my Grandma O'Neill arms. I hate this thigh. I hate these jowls. And you can hate yourself to thin. You can eat things you don't like. You can do things you don't want to do. You can get yourself to a number on the scale or a number on the chart, but you can't live in a state of self-hatred. Right. You can't make the change happen because you hate all of this. The only way you can really make permanent change is to love yourself. And if you can love yourself at 300 pounds, you can love yourself at 180 or 125, wherever your journey takes you. But permanent change only happens through self-love. You can't sustain any body size or type through self-hatred. You can't live there. You just can't live there all the time.
Sure does make the journey more pleasant for you and the people around you.
And everybody around you,
right?
for sure, yeah.
Well, that's all the time we have for this evening. Thanks to our panelists for joining us. Tonight's discussion is an extension of the documentary All of Me. We encourage you to learn more about this film at allofmemovie.com, where you can join the conversation. For KLRU, I'm Seema Mather.